Hi everybody, my name is Ashley Glazer and I am doing my video blog for Liberty University Counseling Credentials and Professional Licensure. I do live in the state of Florida, so I will be providing information for the requirements for this state. In order to obtain a mental health counselor licensure in the state of Florida, you must have at least a master's degree from a regionally accepted or accredited program in mental health counseling or a similar field. It must include a minimum of 60 semester hours or 80 quarter hours. The state of Florida also requires a CACREP accredited master's program with a minimum of 60 semester hours or 80 quarter hours of clinical and didactic instruction. CACREP also requires a minimum of 3 semester hours or 4 quarter hours of graduate level coursework in human sexuality and substance abuse. The practicum requirements are at least 1,000 hours of university-sponsored, supervised clinical practicum, internship, or field experience as required in the standards for CACREP accredited mental health counseling programs. Florida also requires that a dean or a department chair who awards your graduate degree must provide a letter on the university letterhead verifying the course title, the total number of hours completed during the supervised practicum, internship, or field of experience. Some of the requirements for postmaster's supervised clinical experience in the state of Florida includes the requirement of 2 years of postmaster's supervised experience under the supervision of a board-approved qualified supervisor, and the hours must be logged on the verification of clinical experience form, otherwise the hours will not count towards the licensure. During the course of supervision, experience must include specifically 1. At least 100 hours of supervision in no less than 100 weeks. 2. 1,500 hours of face-to-face psychotherapy with clients. And 3. 1 hour of supervision to be conducted every 2 weeks. Some of the examinations that are also required for licensure in the state of Florida consist of successful completion of the National Clinical Mental Health Counseling Examination developed by the National Board for Certified Counselors, a Laws and Rules course that involves completing an 8-hour Florida Laws and Rules course from a board-approved provider list, a 3-hour HIV/AIDS course approved from a board provider, and 2-hour domestic violence course from a board-approved provider list within 6 months of successful licensure. In the state of Florida, the licensure title is LMHC, which is also stands for Licensed Mental Health Counselor. I could not find any information that would indicate that our licensing in Florida is tiered. Does not say anything about it on the board website. And the scope of practice for a licensed mental health counselor is you can treat individuals, couples, instruct group sessions, support people with mental health diagnoses like depression and anxiety. You cannot prescribe medications. However, LMHCs can help explore medication options and advocate for the needs of the clients. I hope this helps you understand some of the requirements for Florida. Thank you so much for watching. Bye.